My name is Sarah Tartoff. I'm a postdoctoral research fellow at Kaiser Permanente, Southern California, Department of Research and Evaluation. And today I'll be talking about our manuscript titled Incidence of PCR Diagnosed Clostridium difficile in a Large High-Risk Cohort 2011 to 2012, which will appear in an upcoming issue of Mayo Clinic Proceedings. So for this study, we evaluated approximately 270,000 Kaiser Permanente Southern California members aged 1 and above who presented as inpatients at one of our 14 medical centers from 2011 to 2012. We assessed for CDI using positive PCR-based testing for CDI, and we calculated incidence rates based on patient demographics and patient clinical characteristics. We also calculated incidence rates based on standardized surveillance definition guidelines. Among all of the incidence rates that we calculated based on patient characteristic, one of the most interesting findings that stuck out in our study was the prominent role that the community environment appeared to play in terms of onset and possibly transmission, particularly for a cohort of inpatients. So overall, 80% of our cases appeared either in the first 72 hours after inpatient admission or in the outpatient setting. When cases appear in the first 72 hours of inpatient admission, generally this means that the patient is bringing the infection into the hospital as opposed to picking it up within the hospital. And in the outpatient setting, for our study, this generally meant that patients were presenting in the outpatient setting after discharge from a hospital stay. A surprising finding from this study was that we found differential incidence rates by race in our study. Kaiser Permanente Southern California has a particularly diverse patient population, and this is one of the first studies to really present that the possibility of differential incidence rates by race. And finally, we report a fairly modest increase of 34% after the switch from EIA enzyme immunoassay to PCR, which is somewhat lower than previously published estimates that range up to 200%. What this suggests is that for hospital institutions that are considering implementing PCR, the increased cost with this change may be more modest than other studies have suggested. That 31% of our patients appeared in the outpatient setting has clinical implications, particularly for primary care providers. As I previously mentioned, CDI is traditionally thought of as something that occurs in the hospital. Therefore, primary care providers may not think of CDI for their patients with diarrhea. However, what this study shows is that if you do have a patient with diarrhea, particularly one who had a recent inpatient stay and is on antibiotics, consideration of a CDI test may be a good idea. Next steps will include diving deeper into our incidence rates. So for example, we saw that incidence rates differ by race. As we move forward, we can look a little more carefully at this finding. For example, is there something biologically inherent that contributes to these differences, or is it something else such as exposure to antibiotic classes, exposure to skilled nursing facilities, or other things that differ by race that may contribute to these findings? The main takeaway message from this article is that incidence rates for hospital-acquired C. difficile that do not take into account cases that occur in the outpatient setting after discharge may substantially underestimate their risk of the hospital setting. At KPSC, Kaiser Permanente Southern California, we have an integrated system, which means that all healthcare contacts, whether they're inpatient, outpatient, in the emergency department, or even by phone, are captured in the patient's electronic medical record. Because of this system, we are able to capture cases that occur in the outpatient setting after discharge. By providing this more accurate assessment of hospital-acquired risk, we're able to better target our prevention efforts, and clinicians are better able to assess risk in their patients.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.